This show is brought to you by the Chiropractic Broadcast Network. Check us out on the web at chiropracticbroadcastnetwork.com. And hello, everybody. Welcome to this edition of Tuning Into Health. This is episode number 180 on this Monday, March 19th, 2012. We got a lot of news for you today. Some interesting news. Well, some little politics involved as well. Of course, it's got to be involved with healthcare and whatnot. And also, what do you think people's expectations are when they go to the chiropractor? It just really goes all over the map, doesn't it? Drives you nuts. Anyway, we'll talk a little bit about that, but the WHO, the World Health Organization, says antibiotic overuse so prevalent, scraped knee could be deadly. Yikes. And antibiotic resistance could be the end of modern medicine. What do you think about that? Who's to blame? Who's to blame, huh? The government to shut down Texas Women's Health Program. Yeah, the government. They can giveth and they can taketh away, huh? Doctors at several Canadian hospitals routinely accept bribes. Yeah, national health care for you, folks. From patients to expedite surgeries. Capitalism always wins. Antipsychotics often prescribed for, quote, problems of living. And children exposed to cigarette smoke have increased risk of COPD in adulthood. Thank you so much. Huh? And Muslim doctors denounce the anti-vaccine drive. And vaccine exemptions, do they really put others at risk? There's a great article by an attorney on this. And Dr. Fabrizio Mancini, he is the president of Parker College. He recently appeared on the Dr. Phil show. Now, whatever you think about Dr. Phil, it doesn't matter. He's reaching a lot of people, so I hope he really got some good news out there. This and more after this. Everybody, episode number 180. Having fun with you. Thanks for allowing me to have fun with you. Oh yes, we've got the news and comment show, health news and comment show coming your way. And this is the stuff that I post on Facebook and whatnot. I try not to get politics involved, but I should, because it's all involved. In politics, you can have politics in sports, okay? No big deal. Politics and sports, it usually comes down to big money. You get politics in, let's say, your local area. Yeah, no big deal. But you get politics messed up in healthcare and people die. So, we'll discuss that a little bit later on. But the WHO, the antibiotics overuse so prevalent, a scraped knee could be deadly. Overuse of antibiotics has become so prevalent that it tends to, if the trend continues, a normal infection could become deadly, according to statements made by the World Health Organization Director General Dr. Margaret Chan. Yeah, she's a friend of Dr. Christopher Kent. I know that. Things as common as strep throat or a child's scratch knee could once again kill, she warned. Deaths from gastroenteritis double in the U.S. What's behind the raising rates? Sinus infections not cured with antibiotics, studies suggest. Speaking at a conference call, Combating Antimicrobial Resistance, Time for Action, in Copenhagen on Wednesday, Chan warned that the drug-resistant pathogens are notorious globetrotters, saying they easily hop from on board with air travelers and are shipped along global traded food and have been accelerated through the hospital-acquired infections. Thanks for the growth of the medical tourism. We are losing our first-line antimicrobials. Replacement treatments are more costly, more toxic, and need longer duration of treatment and may require treatment in intensive care units, she says. So if you don't believe me, how long have I been ranting about antibiotic use? And whose frickin' fault is it? Whose frickin' fault is it? Who do we blame? You know, oh, I'm sorry, I didn't mean to. Oops, was that my fault? It's your medical doctor that's overprescribing you antibiotics for every frickin' little thing, for your sinus infection. That's usually the cause of a viral infection, which antibiotics have no use for. Upper respiratory infections, about 80% of those are viruses, which antibiotics aren't any good for that. It's CYA medicine, and it's speeding you right towards a brick wall. There are better options out there, folks. It's best to take care of yourself. It's best to take care of yourself before something comes into an emergency or crisis situation, which, should I get into that right now? Maybe. Let me finish this one. Okay? Healthcare isn't scrambling at the last minute trying to pick the pieces of your life because of you think that's what healthcare is. Okay? Here's another article. Antibiotic resistance could bring the end of modern medicine. Now, this is from abcnews.com. This is mainstream. Now they're talking about it. But they've been talking about it since 1951, and the problem's only gotten worse. And who brought you that information? The chiropractic profession. To tell you the truth, because the medical doctors don't want to talk about it because they're responsible. Your antibiotic prescribing doctor is a goddamn quack. I'm sorry. I have to say that. He's a quack. If it's not a crisis or an emergency situation, keep the antibiotics out of it. Let the body heal itself. That's what it does. Give it the opportunity to heal itself. If you don't have the professional skill to allow the body to heal itself, then refer to some other profession that does. Okay? Now bacteria evade antibiotics. Common infections would become deadly, according to Margaret Chan, Director General of the World Health Organization, speaking in a conference, blah, blah, blah. So this is talking about the same WHO report by ABC News, only ABC News puts the spin on it, says the end of modern medicine. So, because they're having lots of troubles with tuberculosis and all that type of stuff. So we're moving back into the pre-antibiotic era. So, yeah, and they want to, the miracle of modern medicine. Well, you overprescribed and you overdealt it, and now that miracle is gone. I tell you what. So what is? That brings up the conversation. So what do you expect? What do you expect when it comes to your health and well-being? I get patients that come into this practice that maybe they saw my dad. Maybe they saw my dad years back. And my dad was a great chiropractor. He's a very great symptom oriented chiropractor. I mean, if you had a symptom, he'd find the problem and get rid of it. And he would do it on the most simplistic balance of understanding what causes the symptoms to arise. But being symptom-free doesn't mean you're healthy. And so, 15 years of practice, I've seen a number of my father's old patients who, to this day, they'll say, your dad fixed me. I had a hip problem, and I only had to go once, and it was gone. And I'm like, whoa, wow, that's wonderful. Your symptom is gone with one adjustment? That's impressive. And yeah, it happens quite a bit. Your symptom will be coming and going. But when you look at their health profile, because chiropractic was you only thought of chiropractic as being a symptom-based treatment, like an expensive aspirin. What ended up happening is your spine degenerated and you've got a whole bunch of arthritis that didn't need to be there. And you know what? You're on 6 different medications and you think you're healthy. You think that chiropractic did you any good? I'm sorry. I'm sorry. I don't see that. I don't see that scenario. I don't see how chiropractic did you any good because it got rid of your hip pain once and you never had it again. That's fine. You're on 6 different medications and you have had multiple health problems ever since. So, okay, great, fine and good. The chiropractor got rid of your hip or back pain or whatever and said, okay, you don't need any more care. Well, then the rest of your life frickin' fell apart. What do you expect? Okay. When I have a new practice member come into this office, basically I lay it on the line for them. And especially those people that have gone through chiropractic before and only for treatment of a pain or whatnot. And, oh, it was a miracle. I thought I'd try chiropractic again. That drives me nuts. And it's pain and symptom-based chiropractic care. There's nothing wrong with it, but if you don't tell your practice members that there's something more to it to keep you healthy, rather than, it can get you well and it can keep you well. It's not just get rid of your symptom and out the door you go and then the rest of your life goes to crap. Okay? What we're looking for is a holistic means to keeping you healthy as you can possibly be without the use of drugs and surgery and whatnot. So, hey, look at this. We look at putting your hands in others. That's a pretty common trait among the human race is to put responsibility on somebody else rather than ourselves. Well, when you put the responsibility on somebody else, they can give it and they can also take it away. Here is a government to shut down Texas women's health program. Well, the first thing is it's not really a health program. It's a symptom abatement program. And that's all medicine is symptom abatement, right? The Obama administration on Thursday said it would begin shutting down the program that provides health care to more than 100,000 low-income women in Texas because the state will not allow funding for clinics that provide abortion services. The move follows an announcement last week. So if you're not going to do one thing, we're going to shut the whole damn thing down. Okay, that's fine. They give it, they can take it away. The move follows the announcement last week by the Health and Human Services Secretary Kathleen Sebelius that the federal government would withdraw funding for Texas women's health program after state lawmakers last year enacted an abortion funding prohibition. Because the state is implementing a restriction on the freedom of choice of providers in their women's health care program, that's not permitted under federal law. We have no choice, but we need not renew their program. So, you know what? If you find abortion reprehensible, I happen to find it reprehensible because nobody's speaking out for the baby. And somebody's got to speak out for the baby. It's not the baby's fault you got pregnant. It's not in any circumstance, it's not the baby's fault. So, yeah, anyway. So nationalized healthcare, that's where you can see it going. And, okay, let's put this in a different context. You refuse to get vaccinated. Maybe one child has autism already, and then you got 3 more that they want to vaccinate. You gonna be stupid enough to let that happen? Are you? Okay. Who's responsible for your child's health? So what they've exhibited here is if you don't follow their game, their rules, they can just yank everything from you. Yank every access to emergency or crisis care and all that type of stuff from you. If you don't follow their rules, you're out. Now we'll yank it away. That's what national health care will get you. Here's another thing that national health care will get you. Doctors at several Canadian hospitals routinely accept bribes from patients to expedite surgery in publicly funded health care. One of the major pitfalls of government-run universal health care is long waiting lists for patients who require involved procedures, a situation that devolves into the black market of medical care, where patients willing and able to fork over large cash sums are able to move to the front of the line for medical procedures. And this is precisely what has been taking place in Montreal, Canada, where doctors have allegedly been charging patients thousands of dollars in secret fees in order for them to gain priority in receiving medical care. Oh, there's your price. There's your priceless. Yeah. And if you think that it won't happen here in the United States, you're an idiot. If you think that would not happen here in the United States, you're an idiot. I'm sorry. Nope. Nope. So that's what national health care gets you, folks. It gets you the government taking away when you're not doing exactly what it says that you should do. And then also the black market arises. They found this out with junk food in schools. You remove the junk food from schools, a black market arises. Duh. Oh, anyway, antipsychotics often prescribed for, quote, problems of living. Oh, a pill for every ill and everything. So, Adrienne Fu Bergman was stunned by the question. Two graduate students who had no symptoms of mental illness wondered if she thought that they should take a powerful schizophrenia drug each had been prescribed to treat insomnia. It's a total outrage, said Fu Bergman, a physician who is an associate professor of pharmacology at Georgetown University. These kids needed some basic sleep, like reducing their intake of caffeine and alcohol, and not a highly sedating drug. Those Georgetown students exemplify the trend that alarms medical experts and policymakers and patient advocates, and also chiropractors. The skyrocketing increase of off-label use of the expensive drug class called the atypical antipsychotics. Until the past decade, these 11 drugs, the most approved from the 1990s, have been reserved for the approximate 3% of Americans with the most disabling mental illnesses, chiefly schizophrenia and bipolar disorder. More recently, and a few have been approved to treat severe depression. I'm sorry, the practice of medicine is gone haywire. It's gone haywire. I got to settle down here. The practice of medicine is not responsible. Today's modern medical procedures, or those that are practicing the procedures, are not responsible to use them correctly. And hey, when it comes to emergency and crisis care, I'm all for it. Is there a certain amount of the population that needs to be on a lithium drug? Yeah. A drug to take them, violent thoughts and all that type of stuff, or from killing themselves. Yeah, I bet there is that. But it's a very small percentage compared to what these college students, all they have, the title of the article is Problems of Living. College student, tired. Yeah, don't drink, don't stay out so late, get more sleep. Children exposed to cigarette smoke have increased risk of COPD in adulthood. So a new study published in the Journal of Respiratory reveals that children who are exposed to passive smoke have almost double the risk of developing chronic obstructive pulmonary disease in adulthood compared to non-exposed children. So, ouch. Not good. Muslim doctors denounce the anti-vaccine drive. A pamphlet titled Islam, Vaccines and Health argued that vaccines are harmful and contain harm substances, HARAAM substances, which Muslims are not permitted to use. It claims that vaccination is ineffective and based on long described. So the Islam is putting away the vaccine theory. And you know what? If you don't like it, they will kill you. They will kill you. Don't mess with the Muslims, man. They'll kill you. Yep. Yeah, you can mess with the Christians and Jews all you want. They're pretty peaceful organizations, but mess with the Muslims and they'll kill you. I'm sorry. Jeff Dunham. He was just in Des Moines. I didn't get to see him, though, but I love him. So, but local medical associations have warned this type of information, blah, 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 blah. So they're trying to get the Muslims on board with the whole vaccination thing, the whole theory of vaccination. Vaccine exemptions, do they really put others at risk? Here is a article by an attorney, counselor at law, Alan Phillips. Parents who exercise the vaccine exemption for their children are often ridiculed for putting their children and others at risk. However, legally and medically, unvaccinated children do not pose a significant health risk to themselves or anybody else. Alternative Vaccine News supports this Alternative Vaccine Views support this assertion. But the reasoning in this article comes straight from the mainstream vaccine beliefs. accepted medical practice, and current law. So, and it's got it well referenced. First, from the legal perspective, 48 state legislatures, federal agencies, Department of Defense, U.S. Citizens and Immigration Services, and all U.S. territories offer religious exemption to immunization. The state legislatures and federal agencies providing these exemptions are presumed to have considered whether or not the exercise of these exemptions would pose a significant health risk. It would not have enacted these exemption laws if their exercise would pose a significant health risk. Thus, there would be a legal presumption that the exercise of the vaccine exemption does not pose a significant risk to anybody. This legal presumption is not a mere exercise of semantics or logic. It's based on the widely accepted herd immunity theory, which tells us that so long as most of the members of the population are immune, all members of the population are protected, which that herd immunity is good for natural immunity, not artificial immunity. And Dr. Fabrizio Mancini debuts his chiropractic message on Dr. Phil Show. This is March 16th, 2012. And I'm not a big fan of Dr. Phil, but he's reaching millions of people. And if we can get chiropractic into the spotlight, and it was very pro chiropractic, not pro medical chiropractic. So President of Parker University appeared in the episode of the Dr. Phil Show where he presented the concept of wellness and how chiropractic integrates into a healthy lifestyle. He also spoken about his new book, The Power of Self-Healing, Unlock Your Natural Healing Potential in 21 Days, which includes information about living the chiropractic lifestyle and health and wellness. Dr. Phil, the popular daytime talk show, airs in more than 200 television stations across the United States and is more than 40 countries worldwide. The Dr. Phil Show has a viewership of nearly 21 million weekly viewers, while online the show has more than 2 million unique followers per day. So I'm glad that they've had this opportunity and thrilled that many people around the world heard about the chiropractic and its body's natural ability to heal, said Manny Cheney. This is a tremendous victory for our profession, and the movement started. The time is now to get the message of chiropractic and natural healing to the masses. Now, this is where it's going to be construed in the media. Chiropractic says it cures cancer. Chiropractic says that it cures this, that. That's not at all what they said. The body naturally has the ability to heal itself. That's well documented. That's very provable that the body does have the ability to heal itself if there's no any interference to that healing. So what ends up happening is you got to understand where chiropractic's role in the things are. Chiropractic's role in all this is to give the body the ability, remove the restrictions for that body to heal. So, and that's the only thing a chiropractic does. On that note, we'll be back right after this.
We love our chiropractor, and I've got 3 great reasons why. First, there are no appointments, which is great for my busy life. Second, we don't waste a lot of time sitting in a waiting room. Dr. Chad actually respects our time and schedule. Third, we get unlimited care at a low fixed monthly fee. That's right, my family's care is based on our needs, not the insurance company's ability to pay. You can love your chiropractor too, and your first adjustment at the Spinal Tuning Center is free. The Spinal Tuning Center is conveniently located on Merle Hay Road, right off Interstate 80. Find out more at spinaltuning.com or call 727-4000.
And you are tuning into Health with Dr. Chad. And we're back. What do you think, folks? I know I go off the handle a little bit, and that's fine. That's fine. So what about this membership practice? What's going on there? Well, I'll tell you what. How do I describe it? A lot of chiropractors ask me about, what's this membership practice? Blah, 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 blah. The membership practice allows me to practice, in a way where that's what I thought chiropractic was when I first came in. I've been through the full gamut. I bought a practice. I've started up a practice from scratch. I've gone the insurance route. I've had mega employees. And now it's just me. I don't have any staff. I love it. The whole practice is well, actually, let's say 80% of the practice is on the membership plan. And the membership plan is a flat monthly fee. It's an affordable fee. It's a reasonable fee. And whatever that is for you, that's fine. And they get unlimited care for that flat monthly fee. So, and yeah, I do have per visit rates, but they're exceptionally higher because I believe that chiropractic should be practiced over a lifetime. It's a chiropractic lifestyle. It isn't just for your ache and pain. If you want it for your ache and pain, then great. If you've gone to, I'll even do this. If you've gone to other chiropractors, medical doctors, and you've had your pain for several years, and I can get rid of your pain in a very short amount of time, maybe 1, 2, 3, 5 adjustments, what's that worth to you? If you don't want to join the membership practice, that's fine. It's an affordable thing, and it will help keep you healthy. And if you want symptom abatement, it's going to cost you. It's going to cost you more. So, and what's that worth to you, to tell you the truth? If you've spent thousands of dollars already on the care that hasn't done you any good, and I can get rid of it in a few, hey, I do something different in this practice. I'm not going to say better. I can't say it's better, but I can say it's different. Well, that's great. If you want symptom abatement, it's going to cost you more. If you want to stay healthy, if you want to get healthy, that's going to be a lot more affordable for you. And that's what the membership practice allows for, is to me just to have a membership practice and people joining the membership. And I don't have to worry about collecting any fees or anything. It's just automatically done. It's actually just a really simple way to practice. And I want to get rid of all the BS in my life when it comes to, chasing the insurance dollars and all that type of stuff. So if you have any questions, you can email me at drchad@rohlfsen.com and whatnot. So we got a couple more stories here, just a couple more. Toothaches generally occur in the the tooth's nerve root becomes irritated. Most common causes of toothache are infection, decay, injury, and loss of a tooth. Pain may also occur after a tooth has been pulled. While no one enjoys a painful tooth, there is good news that the tooth pain and infections usually can be relieved and healed naturally. If your toothache comes from an abscess and other infections combined with the use of oil of oregano, topically or internally, colloidal silver, topically or internally, and for swishing, and warm salt water as an alternative, swishing as follows. So talks about taking oregano oil underneath the tongue, hold for few minutes, swish with a lot of colloidal silver as frequently as once an hour. Spit out the colloidal silver and swallow. Excuse me. I know. I had to sneeze. So, yeah, that will be posted at facebook.com/Rohlfsen. Acne among the adult acne on the rise for women, age and hormone kicks in. So, Meredith Mezawalski of Brooklyn, New York, is 28 and still dealing with acne on her face, chest and back conditions that she thought she outgrew after high school. Probably a deal with the rest of my life until after menopause. It's if my mother's dermatological trajectory is any indication. Oh gosh, she has a mother who's still battling pimples in her 40s. So, yeah, I guess, yeah, it's a hormone imbalance. It really is. It really is. I'll have that up on facebook.com/Rohlfsen if that interests you. New studies say that annual pap smear is not necessary for women aged 21 to 65. 21 to 65. Now they're recommending it every 3 years, according to a new guidelines in the United States Preventative Services Task Force. Interesting. March Madness. That's just to cut costs, I think. March Madness offers pizza with every vasectomy. So, Evan Cohen, the manager of Urology Associates of Cape Cod, says his patients will be able to watch the games as they recover from the 20-minute operation while still enjoying their favorite margarita, pepperoni, and Hawaiian pizza. According to Mr. Cohen, March is the most popular month for vasectomy procedures, with men preferring to recuperate in the early spring rather than during the summer months. Millions of men and many women take sickness days from work during March Madness to watch the NCAA's college basketball tournaments, which features a series of 68 knockout games. Blah, 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 blah. New wrinkle for pot debate, stone driving. Angelina Chilton says she can't drive unless she smokes pot. What? She can't drive unless she smokes pot? The suburban Denver woman says she can't get behind the wheel right after she'd never get behind the wheel right after smoking, but she does use medical marijuana twice a day to ease tremors caused by multiple sclerosis that previously left her homebound. I don't drink and drive. I don't smoke and drive, she says, but my body is completely saturated with THC. So her case underscores a problem that no one's sure how to solve. How do you tell if someone is stoned to drive? States allow medical marijuana to have That's true. How do you tell? Pee in a cup just says that they've had marijuana in their system for the last 30 days or I don't know what it is, 30 or 45 days. Anyway, well, that was the news that you could use. I hope you enjoyed all of that crazy stuff. If you have questions on this whole membership practice, you can reach me at facebook.com/Rohlfsen. You can follow me on Twitter at CRohlfsen, ROHLFSEN. Don't let the spelling get to you. But, this membership practice, even if you're a potential practice member, or even if you're a doctor, just give me a call. It's easy stuff. It's a no-brainer. Why doesn't all healthcare be practiced this way? It'd be much better. There's an old saying that the Chinese pay their doctors to keep them well. The Chinese pay their doctors to keep them well, while we Americans, we usually pay the embalmer. Yikes! Anyway, peace out. Bye-bye.